What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and Dr. Corrie Jones is with me today, and we're going to talk a little bit about manual therapy, which in the PT world, I think you can probably talk to 10 different people and get 10 drastically different opinions on when to do it, how to do it, why to do it, or if we should even be doing it at all. So hopefully Corrie and I can kind of unpack a little bit of that discussion and just bring to mind a couple of times of when we think manual therapy is relevant to be incorporated during late stage rehab, which at times it may not be on top of people's minds. So Corrie, we've got a couple different ways that we want to go with this, but what are a couple ways that really stick out to you in regards to manual therapy with late stage rehab?
Yeah, so I think the biggest thing that changes when we start talking late phase is that maybe we're finally getting out of pain. We have our range of motion. We've got our base level body weight strength, and now we're really moving into heavier loads. So we're figuring out force production. We're figuring out force absorption. And then in phase 3 and 4, we're even talking adding velocity to things, right? So we're doing XL decel kind of stuff, maybe introducing some more plyometrics. And then as far as strength goes, we are loading heavy because we want to be able to manage the forces of sport. So I think the big thing when I think about manual therapy in this stage is understanding what comes along with some of that heavier loading and XL decel things in clinic is just changes within the cell matrix, right? There's going to be a little bit of cell edema. There's going to be some metabolites within the tissues. There's physiologically going to be some changes because of the load and the amount of work we're putting on the body. So I think it's big when we get to this point. You see massage therapists and PTs and all kinds of people working manually in professional sports, not always because somebody's injured, but because we're trying to keep going and keep playing. So I think in late phase, our goal is to keep rehabbing all the way to the end of the plan of care, making sure people get all the way back to sport. So manual therapy tends to be something that helps with recovery. We're loading heavy. We're doing all this extra work. We're trying to improve fatigue resistance and volume. And sometimes it really helps to do some of this manual therapy, whether it's mobilizations, deep tissue massage, some dry needling or whatever, just to really help regulate the system and allow this down toning after training so that we get back to baseline. I think just because if we don't get back to baseline, then we have to work our way back to baseline in order to train again just as hard the next time. So it really helps with this kind of hey, let's activate things, get things going, but also recover, getting back to that zero. And then part 2 of that, we all know that manual therapy really helps neurologically with different things. So if because of this added velocity, added force, all of these different things acting on the body, if we have a little more central nervous system guarding, which is normal to a degree, maybe the manual therapy really helps us down-regulate to the point where we're not getting as much of that CNS involvement too, so that we can really get everything calmer, not have this protective guarding state in the muscles, but more so just finding that minimal effective dose in late stage, doing the manual therapy to bring us back to neutral, and then keep going. So I feel like those are the big things that it makes me think of, but I know there's other times too. So I know you have your 2 cents to add. What would you say manual therapy makes you think of in some of those later stages?
So one thing that comes to mind, and it goes right along the same path that you were just talking about in regards to we're training heavier, we're training at higher intensities, and at times you may not feel at your best. And that could just be because of fatigue, that could be because of tightness. So I do think that getting manual work done, it's almost it's a way for you to utilize kind of like a check engine light within your body. And as you're getting work done after practices, after games, after a high intensity lifting session, it's a very easy way for athletes to stay in tune with their body and make sure that they are staying on track. And the amount of times that I've worked with an individual, or I've just hopped on a foam roller myself or started doing some mobility work after just a period of higher intensity training, you become aware of some things that may not have been as obvious that were an issue. And you start to realize, hey, we're in later stages of rehab. I'm no longer dedicating a large chunk of my training to mobility, to some of these recovery tools. And we don't need to, because it's not the primary concern. But we're also not getting that immediate feedback of, hey, what is my overhead flexion look like? Can I still reach down and touch my toes easily? What does a straight leg raise, or what's my hip IR, ER look and feel like? So getting some of this manual work done, it's kind of an easy way for you to also check the boxes, get an idea of what feels different, whether that's for better or worse, and just see, are things trending in the direction that you would like them to trend? And do you need to modify any of your current programming because of some of these things that you're picking up on? Right. The second piece to that is, just because somebody's in late stage rehab doesn't mean that they are completely out of the woods yet. They are not bulletproof. At some point, you're going to realize rehab is not a perfectly linear process, and somebody may take 3 steps forward and 1 step back. And it is okay to put your hands on that patient when they take that 1 step back. You don't need to tell them, hey, suck it up, or it'll get better on its own. You can encourage them and facilitate a productive dialogue that allows them to keep moving in a positive manner with positive thoughts. But don't be afraid to manage symptoms as well. You know, you get an issue on your car, your tires get worn down a little bit. You can change your driving habits. You can fix your alignment. But you got to take care of the tires too. You got to put a new set of tires on them if they don't work anymore. So I think a lot of times we almost feel guilty at times that we're regressing or doing something that may not be the best use of our time. But I think as long as it's intentional and it's serving a means to an end, then I think it's more than appropriate to do so. I don't know if you have anything to add to that.
Yeah, no, I think that's the biggest thing is what you just said. Like, it doesn't mean they're going back a whole phase if you put your hands on them. I think there's always these different trends in therapy, and some of these trends have led us away from manual therapy. And yet we've seen over the years how impactful it is, how helpful it is in different circumstances to really exactly that. Like, make sure people are still moving forward, make sure they're still able to participate as much as they can, and make sure they can keep loading as much as they can in order to finish therapy. So yeah, I think it's big, just not letting the trends swing us one way or the other, but just making sure that we know the circumstances or the context in which to go ahead and do the manual therapy, because it can be super helpful. So yeah, I think you hit the main points, but yeah, that would be my big thing, is just being open to the fact that that could be an answer in that moment that allows you to keep doing some of those phase 3, phase 4 things. So yeah, that's huge.
Awesome. I think the only other thing that we didn't really mention that I have used it and I've seen other people use it commonly is when you talk about your athletes, especially in like a training room environment that are kind of plinth to playing field. They're coming in, they're in season, they're still actively participating, or they're beginning to actively participate, but they're still under the supervision of athletic trainer or PT on staff. It's not uncommon to segue some manual therapy symptom management right into some preparatory work before they go out onto the field. So maybe you're working on this individual shoulder, you're doing a little bit of soft tissue work, you're restoring that end range mobility, and then you're following that up with some sort of PNF or rhythmic stabilization or position-specific isometrics. Then they hop off the table and they go start warming up. So you're using this manual therapy not only to potentially downregulate nervous system, but also stimulate or activate it in a manner that's productive for what they're about to do as well. So,
yeah, true.
Corrie, appreciate the time, appreciate the thoughts. If you listening have any other thoughts on this, feel free to share them. You're listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker. That is Corrie Jones. Thanks for listening.